Hello everyone. So welcome to today's live broadcast on My Family Companion. I'm excited to welcome everyone to today's episode. This is week number 3 and we have done so much already. I want to first and foremost appreciate the Medical Women's Association of Nigeria for being official partners of this several months of impact to women and families across Nigeria and beyond. Thank you so much, Dr. Maureen Okeke, for the chairwoman of the chairperson of the National Outreach Committee, for continuing to spread the news of what we're doing around the nation and beyond. If you're just joining, please get to the chat room. I want to know where you are joining in from, okay? I may not be able to recognize or mention everyone who is joining, but I want you to know your presence is highly celebrated. Last week, we discussed on something extremely important, and this week we're going to be progressing. I also want to appreciate Dr. Digoma, who was with us last week and shared extensively on the things that every woman needs to know about her body as she gets into pregnancy, or even before she gets pregnant. If you did not watch that episode, after today's episode, you want to go back. We looked into the fertile window, the safe period, and how to calculate your ovulation, why certain couples may continue to have sex, but they are not achieving conception. And it's not a spiritual problem, it's not a medical problem, it's just a matter of timing, poor timing. We also looked into very common issues that result in miscarriage and a whole lot of other important things. So you also want to look into that, okay? Today, we are going to be discussing on preconception care. And at the end of this video, I'm also going to be giving us an exercise. I'll be giving this book free again. Last week, we did an exercise. Unfortunately, nobody got the answer correctly. It may be because we didn't communicate the question very properly, or maybe, I don't know, okay? But today, to be a simpler question, I want to make sure that in every live show we have like this, we'll give out at least one book or 2 or 3 to people who are present to encourage the advocacy that we are promoting around the country. Okay, so without wasting much more time, I want to insist, if you are here, share the link, invite every family you know, invite every young lady you know, invite every young man you know. Let us be plenty on the call and have maximum impact with the moments that we will be sharing together. All right. Okay, so let's get started. As you know how we do all the time, we always start by reading the story that inspired the teaching that we're doing for every week. All right. All of these are coming from this book, My Family Companion. It will be available for purchase very soon, but this is our way of getting it out to even people who may not be able to have access to this material. But if you are on this call, once the book is live, I'm going to announce it, and everyone can have access to it. My birthday is on the 30th of September, and I'm thinking maybe I could use that day to make the official announcement. So fingers crossed. I didn't say anything. Okay. All right. I want to know where you're joining in from. Please keep dropping the comments in the chat room. We're going to be looking on this call details on preconception care. Why is it some women have extremely excruciating pregnancy experience? Others just enjoy and cruise. When I was in medical school, I had a senior colleague who was pregnant. The lady just kept coming to work, delivered today. The next day wasn't at work, but the following day she was back at work. The consultants were telling her, go back, young woman. And she just said, I just want to continue my work. And you could look at her, she's so active, so alive, so full of herself. Why do some people have this kind of experience? Of course, she was a medical doctor, so she knew the right things to do. And then other persons just get into pregnancy as an event that just happens and they don't plan for it. You don't have a visitor coming to your house and then the visitor just shows up. No. If a visitor informed you that he or she is coming, you prepare to receive that visitor so you have a good experience for the duration the person is with you. The same with pregnancy. If you don't prepare well for pregnancy and it just happens, chances are very high you will not have a very good experience with that pregnancy. And for many women, after their first conceptions, they often tell themselves, I will never again be pregnant, or just all this kind of stuff. Okay, so today I want to look into how can you ensure that whether in your first time of pregnancy, it is going to be so smooth and sailing, or whether in your second pregnancy, the first one wasn't so good, you want to have a smooth one. Some people may have a very beautiful first time pregnancy, but in the second experience, it becomes full of trauma and drama. There is convulsion, the feet is swelling, there is all kind of sugar goes up, it comes down, the baby is too big, a lot of irregularities. Why? Because the previous pregnancy and the next pregnancy are not the same. So you cannot say I've been pregnant before, I didn't have any challenge, that the next pregnancy will happen the same way. No, every pregnancy is unique, every conception is different from the previous one. And that's why you need to understand preconception. Okay? As a matter of fact, immediately after your pregnancy, your body has changed. Your first pregnancy, you are no longer who you used to be. So even if you had a beautiful, seamless experience in the first one, chances are right now that you are chubbier than you were before. Your hormonal dynamics have changed. Your sugar, your blood pressure, a lot of things have changed between this, your current state, and who you were when you had your first conception. Okay? So all these are by way of introduction. Then I'll be showing you key things to calculate to always know, okay, this I need to correct, this I need to improve before you get into pregnancy. All right. So once again, share the link, invite everybody who is supposed to be on this call, and let us get started. So we're going to start with the story of Kate. So this is in chapter 3 of this book. So let's read. I want you to pay close attention. Everything we're going to be teaching is going to be built on the story we have right here. My name is Kate. If Kate, you're on the call, we're not talking about you, okay? Every story here will have consent to share from the patient whose story are documented here. However, they've been anonymized, right? So what that means, we've changed the names, we've changed the locations, but all the clinical data are maintained just so that the medical information is communicated in the exact way it happened, but the identity of the individual has been concealed. So if your name by any means is Kate and you're 36 years old and perhaps you're pregnant, this is not for you. All right, this story is not yours, okay? So my name is Kate. I am 36 years old. I am pregnant with my first child. I've been married for just over a year. And while this pregnancy should be one of the happiest seasons of my life, it honestly has been one of the most difficult. 2 years before I got married, I was diagnosed with both diabetes and high blood pressure. At first, I didn't think much of it. My mother had lived with both conditions for years, and I just assumed I would manage it the way she had managed hers. But the truth is, I felt mostly fine and was busy planning my wedding. I wasn't on any medications whatsoever. After my wedding, my husband and I started the thing, like began to have sex, I believe, yeah. It didn't occur to me to ask, am I really healthy enough to carry a pregnancy? Fast forward to now, I'm 9 months pregnant, but the journey has been anything but easy. I've spent more time in the hospital than I've spent outside of it. In fact, I'm sharing this story from the hospital. My blood sugar has gone up and down like yo-yo. My blood pressure, don't even ask. Some days it's so high, I am scared to sleep at night. I've had multiple scares and health complications that left me anxious, breathless, and honestly exhausted. Last week, my doctor told me that my baby is too large, a condition he called macrosomia, due to my diabetes. A natural birth is now out of the question. I've been booked for a C-section in 4 days, so I'm currently in the hospital on admission so they can closely monitor my vitals and prepare me for delivery. What I have not even told you was that I began my antenatal care at a maternity home near my house. It was in my 4th month when I had an emergency with my blood pressure that I was taken to this current hospital. I lie here every day looking at other pregnant women who just stroll in for antenatal visits, laughing, glowing, eating gala and zobo. And I wonder, why me? Now, I'm counting down to my operation, praying my baby comes out healthy and whole. I still believe that being a mother will be worth it. But I've also learned the hard way that my health needs to be in a good place for a smooth pregnancy to happen. If you are living with a chronic health condition, whether it's diabetes, blood pressure, HIV, hepatitis, or you're obese, or even have some mental health issue, please don't rush into pregnancy. Get medical advice first. Let your doctor help you to stabilize your health, adjust certain medications, and prepare your body. My doctor told me it's called preconception care, and it can make all the difference between a smooth pregnancy and a turbulent one. Yep, and that is Kate's story. And this patient of mine, that's a couple of months ago, they already, as at the time we're writing this story, she was in the hospital telling the story. They already have their baby, a couple of months old, and it's it's amazing that just not having the right information can cause someone to have an experience that ordinarily should have been a smooth one, and it becomes a very challenging one. Something even as simple as a cream you are rubbing, or if you're a lady, you're always interested in your facials, maybe you have pimples, you're trying to treat it. Some creams you use can even make pregnancy to be a difficult experience. And we're going to be looking into all of those on this conversation. Okay? So let's get started. While we're at it, as the conversation is going on, be dropping your questions in the comment section, and also make sure you invite more persons if you haven't already. Last week, we've had, between last week and now, the last premiere have gathered nearly 900 views from different people with nearly 130 hours of watch time on the content, showing that people are really, really interested in what we are saying. So please go ahead and lend your voice to this advocacy. While you learn, help someone else to learn also by inviting them to join. Maybe you can all sit down, invite them to sit down and also watch at the same time. If you're on the screen, if you're on your devices, they could all join and also watch. All right, that's the best way you can support what I am doing right here on this health advocacy. Okay, let's get to it. So what is preconception care? All right, I'm going to give you a general overview. So preconception care is different from antenatal care. Antenatal care is the care you begin to receive the moment you get pregnant, which ideally should commence immediately. You miss your period and you do the urine test, it confirms you're pregnant. You need to immediately go commence your antenatal care. Why? Because certain health issues can spring up between that first week of conception and some weeks down the line, of which some women who say, I've been pregnant 3 times, I know all that is involved, may run into those crises like an ectopic pregnancy. If a woman gets pregnant and the baby is not growing in the womb, maybe growing in the abdomen, everything may look normal. She may be having the normal pregnancy symptoms, but sooner or later, that pregnancy will burst, and we'll call it a ruptured ectopic pregnancy. And that woman will be in a severe situation. It can lead to death because the bleeding will be massive, and in a matter of minutes to hours, someone who was smiling may literally be dead. So that's why it's important that the moment you miss your period, it's it's the right time to go immediately and commence your antenatal. Your doctors will not give you back-to-back appointment. They'll give you an appointment on a monthly basis in your first trimester. In your second trimester, they'll give you an appointment on a 2-weekly basis. And your third trimester, they'll give you an appointment on weekly basis. So it's designed to be sure that you are not overworked, okay? So don't delay going for your antenatal. However, antenatal is not preconception care. Antenatal care is not preconception care. Preconception care, just like the name is before you conceive, the care you receive before you conceive. And certain women need it. Some women may not need it, but it's not in your place to decide. Just like you don't make a diagnosis for your health condition, your doctor helps you make the diagnosis. So every woman generally needs preconception care, all right? So we're going to be looking into when do you need it? Under certain conditions, under what conditions do you need preconception care? All right, we're going to look at the health conditions, social conditions, work condition, and even things like lifestyle conditions, like the creams you are using. I'm going to show you how to check if the cream you are using contains anything that may affect pregnancy. Facial cream, body cream, cream to remove scars, or what do you call it, stretch marks, all those things. Some of them, they're good for the body anyway, right? But they're just not good for pregnancy. Then the next question is, how long is preconception care? All right, unlike antenatal care that is designed to be for a 9-month period for the duration of the pregnancy, preconception care is customized for every woman. It depends on what the doctor sees on you before, while people begin to plan for conception. Let's say you show up and your BMI is 35, all right? And the doctor tells you, this is really trouble. It may result to diabetes in pregnancy. You may have high blood pressure. You may have convulsion. You may have an overweight baby that makes delivery extremely difficult, not because your baby naturally is supposed to be big, but because the child is receiving extreme amount of sugar while in the womb. It just blows up. And that will become not so good for the child even after delivery, okay? And also not so good for you. So we'll look into when the doctor then sees you, then he plans with you the exercises you do, you change your food, and a few other lifestyle modifications that will result in you losing some weight before you conceive. I'm going to be asking you or teaching you how to calculate your BMI somewhere within this teaching, and then at the end of the session, I'm going to ask you a question, and I'll require the person who gets the answer correctly is going to get this book for free. Because nobody got it last week, I'll be giving 2 books for free today. All right, so the first 2 correct answers. Okay, don't go Googling it. I'll teach you how it's done, okay? All right, let's get to it. So in other cases, it may be that the woman has sugar or diabetes. Then we need to control your diabetes with some medications to bring it to a certain level, and then update your food and the content of your meals over a long period of time, taking away the medication to maintain you on a sugar level consistently before you get into conception. In some other cases, maybe some people are currently on medication, right? Or maybe like the creams I talked about, your doctor will also help you to gauge how long it will take for those medications, even if you stop them, for the ones that are already concentrated in your body to ward off, so that the baby you conceive will not be exposed to those things. So that's what makes it a little here or there, depending on the woman. The other women that may come immediately will look at them and be like, "Go and have your baby immediately." All right. So besides these medical reasons, there are other social factors for which we may also tell a woman to delay conception before she takes in. All right. And these are also things we look into in the preconception plan. All right. We may advise concerning the kind of work you do. All right. Let's say you work in a laboratory and you have continuous exposure to certain kind of chemicals that are very toxic. All right. who may require you not to immediately get pregnant, stay away from work for a long period of time, have those chemicals ward off from your body system before you try conceiving a child. Let's say you work in an X-ray department in a hospital, or you work with the neurology team, and maybe while in the theater, you could do a lot of snapshots with radioactive processes like radiation on X-ray and all those filmings we do to see what we are doing for patients. Not that you're always exposed to it, but small radiations here and there in that environment may be present in your body, and you don't want to have that and also conceive because it will massively affect your baby. So those are some of the things we also talk about. We also want to look into family support, right? There is a circumstance under which you've been, your doctor may just suggest to you that why not wait until you have this level of support around you before you start trying to conceive. Because when you get into pregnancy and you don't have all the support you need, it can be very difficult. Okay, all right. We also tell you about becoming mentally ready for pregnancy and ultimately financially ready. All right. Okay, so one of the ways to ask that question when a woman comes for antenatal, I will say, was this pregnancy desired and planned for? And the answer should always be yes. Most women who have a yes to that have beautiful pregnancy experience. Okay, so let's look into what medical conditions or under what conditions should a woman intensely have a need for preconception care. Number one, if a woman is overweight, all right, and with that, you may see another woman who is chubbier than another person, but then when we do the calculation, we'll tell you that this other woman is more, the one who looks less overweight in your eyes may actually be more overweight compared to the one who on the outward, when you look at it, looks like this person is fat. All right. So because BMI is, you calculate the weight with relationship to the height of the person. So you may see someone who looks very fat but is also very tall, and that cancels out, and the person's BMI is not bad. But then you see someone else who is not so tall and a little chubby, and then the outcome on the BMI calculation is not completely very positive. So how do you calculate your BMI? All right. I'm going to pause a little right now and get a writing board to demonstrate that. So you just give me a sec. I'll pause the camera and then get the board, and then we'll continue. Okay, so this is how you calculate your BMI. BMI, all right? It's equal to weight in kg divided by height in meters squared. So if someone is weighing 80 kg and then the person's height is 1.5 meters, and you are told to calculate the person's BMI to know if this person is overweight or underweight. All right? So underweight is 18.5. Anything below this, it's already considered not good. And I'll explain why as we continue the video. Then anything above 25 or 25 is also considered overweight and is also not good. All right? So just have these two extremes. Anything between this is good. So let's check for this person. So we're going to have BMI equals to weight in kg. So the weight is already in kg. So we'll have 80 divided by 1.5, which is in meter already. So you have 1.5. Then you square it. So this will give you 80 divided by 2.25. And this will give you 35.555, which is approximately 35, or let me say, yeah, 35.6. So this person is very much above the normal BMI. So this person is obese, all right? And this person will not have a good pregnancy outcome. So that's how you calculate BMI. So you have the weight in kg and then height in meter square. So let's say you were given the weight in pounds or milligram, all right? So you know 1 kg is equal to 1,000 gram. So let's say someone is weighing 80,000 gram. You are given the weight in grams, okay? So and then you are given the height in cm. So let's say the person is weighing 150 cm. And you're supposed to calculate the BMI. So what do? You convert this to kg. So how do you do that? You divide by 1,000. So 80,000 divided by 1,000. We'll cancel the 3 zeros. You have 80 kg. All right. Then cm, you simply divide by 100 to get it, because 1 meter equals to 100 cm. All right. So to convert this cm to meter, it is going to be 150 divided by 100. And that would bring it to 2 decimal places, 1.5 meters. So now that you have it in meters, you have it in kg, you go ahead to calculate the BMI, which is now equal to 80 kg divided by 1.5 meter, you square it. All right. And that gives you 80 divided by 2.25, and that gives you approximately 35.6. Okay, and that's how you calculate your BMI. So we're going to continue the video, but this is how it, and this is the quiz I'll be giving you at the end of this exam, not exam, at the end of this session, and I may give it to you in pounds, so you convert from pounds to kg and then do the calculation. All right, so let me move this. Yes, so that's how you calculate the BMI. And the goal isn't just about losing weight, it's about arriving at a healthy balance that is good for your pregnancy. The reason is because when people get into pregnancy with overweight or even obesity, which in the case of what we just calculated, those persons have high tendency of running into diabetes. Some of them may even have high blood pressure in pregnancy, and it may alter their entire hormone and metabolism, resulting in complications in their pregnancy. And then in some cases, not in some cases, once that diabetes is in place and there's now need for the person to start being managed for diabetes in pregnancy, you start taking drugs you previously were not supposed to be taking, and then the sugar in your blood will so much get your baby so fat or big that the child may not comfortably be delivered vaginally. There's now need for a cesarean section, and for these are people who even go to the right places. All right, for people who then go to maternities or traditional birth attendant, they will try to do normal labor. They will be pushing and pushing and stay in labor for several hours and days, and those are some of those complications that result to death in many women. And that's why it is not good for you to be overweight and get into pregnancy. So if you are not married right now and you're already on the big side, this is the right time to start shedding off some of those weights so you have a lean body in preparation for pregnancy, because pregnancy on its own will expand you. All right, and that may not be good even for you after pregnancy, because I know everyone wants to get back in shape after pregnancy. So already have a good shape before you get into pregnancy, just so that after pregnancy it can be also very easy for you to return back to shape. Likewise for your baby. Okay, the second is underweight. As much as we are concerned about being overweight, it's also not good for you to be underweight. And the reason is because when a woman is underweight, all right, you have risk of having a child that is also now too tiny, and maybe a child who will come out preterm, meaning a child that is born before 37 completed weeks. All right, and this is very risky. The woman has risk of getting into anemia, and once there's anemia, the child will not be receiving enough oxygen and will also cause growth restrictions while the child is in the womb. And you're already giving the child a bad start off to life. comes out struggling while others are coming out rejoicing, actually crying. Okay, so you want to make sure that you don't get into pregnancy being underweight. So the underweight, when you do the calculation, is going to be anywhere below 18.5 in your BMI. It shows that you are really, really too skinny to get into pregnancy. So you need to build up some muscles and some fat and just be in a good place before you get pregnant. All right. So this is why underweight is very, very, very bad for pregnancy. The next is high blood pressure. All right. So high blood pressure before pregnancy would cause a woman to have what we call preeclampsia. All right, which can damage the organs. All right. So in a woman and affect the pregnancy so adversely. All right. It could also lead to placenta abrasio, which is where the placenta pulls off from within the walls of the womb. And that will cause severe bleeding. It's a medical emergency. In fact, it's a surgical emergency because immediate intervention through operation is required. If the distance from the home to the hospital is far, that woman may die before she even receives help. So this is also why you need to also make sure you control your blood pressure before you get into pregnancy. All right. And for people who already have that and are already pregnant, this is why you need to follow through properly with everything your doctor is telling you and why you should not go to a quack, a traditional birth attendant, some maternity home, or some people that claim to be midwives, but they are not, because no professional midwife would do these things I just described. All right. The next thing we want to talk about is diabetes. All right. In some persons, they may have diabetes, but they may not know, and pregnancy shoots it out. Some persons may not even have diabetes, but when they get pregnant, we have what we call gestational diabetes, where diabetes now show up in pregnancy. Some people, that gestational diabetes now continue to be diabetes even after pregnancy. But whatever be the case, you can just simply check by just doing a simple fasting blood sugar. All right. These things are done routinely when you go for antenatal. But if you already know that you are diabetic before pregnancy, all right, like in the case of Kate, the story we read, Kate was diagnosed with diabetes 2 years before she got pregnant, before she even got married, all right, but she didn't do anything about it. So in such a case, there's need to do some modifications in the food she eats and also modification through some drugs to get her diabetes and sugar level to a certain level, and then continue it with proper meals that will maintain that level of glucose in her blood before she gets into pregnancy. All right, and that is very important. Okay, the next thing I want to talk about is people who have a condition of epilepsy. All right, where they are and they're on certain anticonvulsants. Some of those medications, we're also going to talk about some other medications like the creams we talked about. Some of those medications result in birth defects. All right, so for women who have history of epilepsy, all right, there's now need for you to have a proper time with your doctor. We may need to change your anticonvulsant drug to certain types that do not affect pregnancy. Then we'll also need to give time for the ones you've taken previously to clear from your system before you get into pregnancy so that it doesn't affect your baby. In such women also, we give a specialized dose of folic acid to make sure their babies are not affected. All these things your doctor will tell you, but if you're already pregnant, you also want to discuss this with your doctor, and these key issues will be highlighted. All right. If certain mistakes has been made, we can do ultrasound to just keep monitoring and see how your baby is developing within those first trimester to be sure everything is going on properly. All right. The next people that need, importantly, very importantly, need preconception care is people who have certain kinds of infectious diseases like HIV, like hepatitis, like cytomegalovirus, CMV, and certain other kind of infections. If you are having any infectious disease, there's what we call prevention of mother-to-child transmission. It's so beautiful what God does, right? That a woman can be HIV positive, but through certain efforts and methods we can protect the child from receiving the same disease. And we call this prevention of mother-to-child transmission. However, there's need to reduce the viral load in such a woman before she gets pregnant. And those are the things we discuss in preconception care. All right. So the next kind of people who also need preconception care, very importantly, are people who are Rhesus negative blood type, especially if they have been sensitized in the past. You know, the thing is this: when you go to do your blood type and you go to check, and that's the required investigation. When you go there, if you're rhesus negative, that's what it will be found out to be. But that same test does not show if that rhesus negative has been sensitized. There's a different investigation called indirect Coombs test, all right, that we can use to check if you've been sensitized already. All right. Last week we discussed it very extensively. Not last week, 2 weeks ago. That was what we discussed very extensively. So if you were not there, you want to go and watch that episode, it's there on YouTube. Okay. So if a woman has been sensitized already, it's very important for her to also go for preconception care, because she may be at risk of having Rhesus disease in the child and affecting the child over and over and over, resulting in multiple miscarriages and multiple deaths, stillbirth if the child progressed to delivery. However, with proper insight early on, certain things can be done to manage that pregnancy, monitor it progressively, and make necessary interventions when necessary, and maybe that child could just come out healthy. All right. The next set of people that need preconception care, follow me closely. We're starting from the most obvious to the ones that seem so silent, but this affects everybody, okay? Are people who have had a miscarriage in the past. If someone has had a miscarriage in the past, the chances are high that he or she may have miscarriage again. It may be for some modifiable reason or for some non-modifiable reason. Let's say something about her body results in miscarriage, all right? Or there was something she didn't know that she did wrongly the last time. If her knowledge has not been updated, she could also go into pregnancy and repeat the same mistakes and also have miscarriage again. But whether it is a modifiable factor or non-modifiable factor, with your doctor being in the know, we can do certain things to ensure that the outcome is different from the previous one. So if a woman has ever had a miscarriage before, tell her before she conceives again, let her go and see a doctor so that certain evaluations will be done to understand what probably caused the last miscarriage. All right. So the next is advanced maternal age. All right, which is very, very important. I'm going to be making a video within the week where I'm going to be talking medically why you must marry before you are 30 as a lady. All right. Now, this is not on social grounds. This is not on political ground. This is not on gender grounds. This is purely on medical ground. Why you must get married before you're 30. The reason is because advanced maternal age is really oftentimes a risk factor, especially for first-time pregnancies. For example, in Kate's story, Kate is 36 years old, and this was her first pregnancy. We're not surprised she's having those complications. So if you're in your late 30s, and this is your first time getting pregnant, or you're just getting married, about getting pregnant, you need to see a doctor. All right? Let me not even say late 30s. If you're 30 plus, the reason is because there are numerous, but let me just say a very common one. You could have a very present fibroid, all right? That's the street word for it, okay? And it is present, and once that is present, depending on the size and the location within the womb, it can make a woman to continue to have miscarriage or difficulty in holding a conception even if it forms, all right? And this is another reason why you need to go for preconception care. In some cases, when we see women like that, we may need to do an operation. Yes. So there are couples who come and they're about to get married in November. All right. And this is July. Then we do the operation there in July so that before November, she has had 3 months of proper healing. And then immediately they're getting married, she could immediately begin to conceive. But if she got married in November and there's a persistent fibroid based on the size and the location, it may make their ability to conceive children delayed for a long period of time. All right, because those fibroids will keep affecting conception and there will be need to remove them. So this is why preconception care is important in women from 30 years and above. All right, especially for first-time pregnant women. The next thing is long-term use of certain medications. So if a woman has been on anti-cancer drugs for a long period of time and she wants to conceive, we need to stop that medication for a duration so that the half-life, let me come back to my normal language, so that the drug can clear from her system and not affect the pregnancy when she conceives. If she's been on certain anti-epileptic drugs, which I've talked about, even some BP drugs, all right, all of these things need to be stopped. And this is where I now talk about the creams. Any cream you are using right now, this is what I want you to do. You're going to take the cream. So let's say this is the cream. Then you are going to go to the part where it has the ingredients. Okay. I want you to snap it picture, take that picture, upload it on your ChatGPT and ask ChatGPT, does this cream or lotion contain retinol? Retinol, or any other ingredient that is harmful in pregnancy. You drop it. ChatGPT will analyze those ingredients in that drug, in that medication, in that body cream, and tell you it contains this, it contains that. This is healthy, this is not healthy. You need to stop this, you need to continue this. Very simple. All right. And this is important right now, not later. Especially if you're looking that your marriage is close or you're looking at conceiving anytime soon. Whether it's your face lotion, those lotion you use for removing scarifications or stretch marks or pimples, whatever it is, if they contain retinol or its different variations or certain other ingredients, they can cause birth defects, affecting the brain, affecting the eyes, affecting the spinal cords, and making the child malformed. In some cases, it could also lead to miscarriage. And this is important for you. You need to know it. Okay? Then, if a woman has had abortion before, especially unsafe abortion, or have had any kind of pelvic surgeries, any surgery that required opening your abdominal area and anything happened there, whether it is appendix or anything at all, okay? There is need for you to see a doctor before you conceive. The reason it is important is this. There may be scarifications, all right, that will cause scarifications is like when a wound heals, right, it will form a scar. Those scars may match up certain parts of the reproductive tract and may result in ectopic pregnancy or some other complications that are completely avoidable. So that is why you need to see a doctor if you've had an abortion, if you had an operation within your pelvic area, all right, or your abdominal area. Okay, so now let's also look at other dynamics, non-medical dynamics, non-medical conditions, circumstances, events that may prompt that there is need for you to see a doctor before you go to start conceiving. Number one, if you have been using substances like drugs, alcohol, and certain things like that, those things store up and can affect your baby before pregnancy. There's need for you to stay away from them for a long period of time before you get into pregnancy. And of course, when you get into pregnancy, you are not supposed to continue using them. All right? Even smoking, people who smoke or staying around people who smoke can also leave certain deposits in your blood and also affect your pregnancy when it is time. Okay, so the next is people who do hookups or multiple sexual partners. Why is this important? It's important because it is a high risk for infectious diseases. And some of these things may be present and low-key. Something like hepatitis. It may be there and be quiet for a long period of time. Current data shows, am I correct? Yes, that nearly 8 out of 10 of every Nigerian have been exposed to hepatitis in one way or the other. And that's very scary, all right? Some people may be carriers, some people may have the disease itself. So if you have had history of multiple sexual partners, especially with unprotected sex, this is not about you did the wrong thing, you did the right thing. It's about making sure your child is not exposed to some of those things. You see a doctor, you do a complete screening, establishes your health before you get into pregnancy, so that we can initiate prevention of mother-to-child transmission early before you get into pregnancy, and also advise you on how to carry yourself throughout the period of pregnancy for your safety and for the baby's safety. All right. The next is extreme inter-pregnancy interval. What does this mean? The interval between your last baby and your next baby is very important and may require that you need to see a doctor before you go to conceive. So I'll give you an instance. Let's say your last baby was born in 2019 and this is 2025 and you want to conceive again. That is more than 5 years. The extreme we have, it can be too close, it can be too far apart, and both of them are not healthy. What is too far apart? Pregnancy interval more than 60 months. 60 months divided by 12 months equals to 5 years. Simple. So if a child you had was 5 years ago and you're about to have another baby, it's very important that you see a doctor. So we'll do specific assessment and advise you on how to carry yourself throughout that pregnancy, because oftentimes women with extreme pregnancy intervals often have severe pregnancy experience. Also, when the pregnancy interval is too close, anything less than 18 months, it's oftentimes not good because the woman's body is not yet properly rested. She may have a child who is underweight, she may have she may have anemia in that pregnancy. The child will have growth restrictions, come out preterm, come out underweight, already at risk from the moment the child is born, having a bad start to life. That's not good. So extreme pregnancy intervals is also a need for you to see a doctor before you conceive. And then you have domestic violence. All right. If you are in a very unhealthy relationship, it's very important that you consult with a health professional before you attempt to conceive. All right, because it can result. Of course, it's very easy to understand why that is important. All right, so it's not as though the doctor will do anything, but you receive the proper counseling on how to go about making sure you have a secure environment, the human rights people around you, and all of those things to make sure you have a good pregnancy experience. All right, and then on this aspect, finally, is exposure to radiations, toxic chemicals, environmental hazards, people who work in hospitals. If you work in a hospital, before you get pregnant, go and see a doctor. If you work in a chemical lab, before you get pregnant, go and see a doctor. If you work in industries, if you work in industries that has very toxic chemicals or cement products or asbestos that make roofs and all of those kind of things, and you are a woman, it's also important for you to see a doctor. You'll be given the proper counseling. Your blood will be taken, certain cells will be checked to see the level of toxicity present in your system, given proper time for it to clear before you conceive. Okay, and then let's look now at what are the conditions under which pregnancy is a no-no. All right. The first is if a woman has cancer. If a woman has cancer, and particularly breast cancer or any of those gynecological cancers, all right, maybe cervical cancer, we usually tell them, no, you can't get pregnant, because what we are checking right now is the risk against the benefit. Oftentimes, those women will die because pregnancy is on its own. Let's look at it as a disease per se. your immune system will step down generally. And that's why pregnant women are at more risk to having malaria than the ordinary people. What would not cause infection in an ordinary woman will cause infection in a pregnant woman. And that's why you see them having candida, white thrush, all those things during pregnancy. So cancer already is something battling the immune system of a woman. So if a woman has cancer and also takes it alongside, there's a double pressure on her immune system and it can be very, very dangerous. So that's why we advise against that. Then other health situations that affect the key vital organs like the kidney, because throughout pregnancy, the kidney is working for two people, clearing for the woman and clearing for the baby everything that the body is making as waste products. And that's why it's very important that if a woman has any form of kidney disease, we need to be very careful about her conception. So you need to make sure your health is in place with respect to kidney before a woman takes in. All right. And then other things like respiratory illnesses and then heart diseases and so on and so forth. So if you have any kind of chronic illness, there's importance, right, that you see your doctor before you conceive. All right. So these are all the conditions that make preconception care extremely important. When women don't understand this and they get into pregnancy with these circumstances, they have adverse pregnancy experience. But if a woman gets into pregnancy healthy, she would have a smooth pregnancy experience. Of course, because there's a antenatal by the side to guide her all through those stages. Yep. So that is all that we have to teach today on preconception care. Right now, I want to give you a question. I'll give you an exercise, and you do that, and then I'll ask you a question. Those who get it correctly, the first two persons are going to be going home with a gift from me today. All right. A woman that is your friend is weighing 82 kg. All right. Okay, I've given you the softest landing, right? She's weighing 82 kg. And then her height is 165 cm. I want you to calculate her BMI and tell me whether she is overweight, underweight, or within the normal weight. I'll look in the comment section now to know those who have gotten the answer correctly. I'm going to say it again. So the woman, your friend, she's weighing 82 kg and her height is 165 cm. Calculate her BMI and let us know if she is more than, or rather, and let us know if she is overweight, underweight, or within the normal weight range. Remember, underweight is anything below 18.5. Overweight is anything above or equal to 25. Then anything between that is normal. So let's do the calculation. While you are doing yours, I'll be doing mine. So she's weighing 82 kg. Her weight is 82 kg. Her height is 165 cm. So what would that be? My calculator is here. Okay, I have my answer. So while you're typing your answer in the comment section, let's talk briefly about what we are going to be looking into next week. All right. First of all, two things. I want to ask you if everything we do on this channel is benefiting you. I'd like you to like, subscribe, invite everyone you know, all right, who this content will also be of value to also like, subscribe, and follow what we do. And then also throughout the week, I continue to share on other things that are perhaps not related to this area. This channel, I use it to teach in all the areas that I'm playing as a person. I am a medical doctor, for which we do this every Sunday. Every Saturday morning, I release a Bible study teaching. For those of you who are Christians, even for non-Christians, you get a lot of value from that. Every Saturday by 7 a.m., I'll be live here teaching. All right. Then throughout the week, I share on various issues on health, on leadership, on success, things that have been my experiences over these years, and even some of my current experiences. Okay. So that's by way of telling you to support what I am doing right here. Then, on the key things that we discussed today, there are numerous. I think we've mentioned more than 17 key issues that affect pregnancies, and some of them, which one resonated with you the most? Which one do you know someone who have had this experience? Which one are you going to be watchful about? Do you know your weight? Have you checked it with respect to your height? Have you checked your blood sugar? Have you checked your blood pressure? Extreme pregnancy interval, all the things we've mentioned, which one resonated with you the most? That's the first thing. I want to see it in the comment section. While you're also dropping your questions, the number two thing I want to ask is, if you're on this call and some of the stories I've shared are related to your experience and you would like me to interview you and you tell your story to the world, I'm inviting you. All right. I want to use this platform to give you a voice. Perhaps someone is out there willing to hear your story and learn, also to even support you where you are right now. So all you just need to do is to drop it in the chat room, in the comment section, and I and my team will contact you and we'll take it up from there. Number three are your questions. I may not be able to be responding to the questions, answering all of them this way, because I don't want to keep the video session too long. However, every question in the comment section right now, I am going to be active now, typing and responding to every single one of them. Okay? And finally, is there any topic you think that you would like me to address? I may not address them on Sunday Live, but I'm going to make a video about it within the week and put it in the channel for you and for everyone. I've seen people who reached out to me and said, Doctor, what about sex during pregnancy? It's covered in the material and we're going to get to it. But if those are things you want to hear about, please indicate them and I'm going to be making videos on that for us. All right. Next week, we're going to be moving into antenatal care. But when I say this, people would think that this is about a pregnant woman. No. This is about everyone who is listening to me right now. The story we're going to be hearing next week, let me confirm her name. Give me a sec. The story is about... all right, it's Deborah's story, Debbie's story. So this lady had ectopic pregnancy on the left side and it was ruptured when she came to our hospital. Almost near-death experience. We were able to operate, saved her life, but she lost the tube permanently. While in the theater, we saw that the right tube was also gone. And we, after in the recovery room, we discussed with her, realized that she was pregnant when she was 16 years old. She was raped when returning from somewhere, didn't inform her parents, and didn't know that she took in. Days turned to weeks, and one day in the middle of the night, she wakes up with a pool of blood. And she was rushed to the hospital, holding to the left side of her body. The right side, the parents were shouting, appendix, appendix. But appendix will not result to vaginal bleeding. So at the hospital, the doctors operated and removed the right fallopian tube, which was massively damaged based on what we saw at the operating table. Now, years later, she takes in again, and then she had the same ectopic. Why did she have this experience? Because she didn't understand the key things to do during antenatal. It's not everywhere that is qualified to give you antenatal care. She was going for antenatal, funny enough, but it was somewhere close to her home, to some favor room, as they call it, by some traditional birth attendant. They even pray, they take care of everyone so warmly, except that they don't do the most important things. And they didn't do ultrasound, they didn't confirm her pregnancy, position, and the age, and all of those stuff. And they did a blood test, or they did urine test, established she was pregnant, gave her folic acid, gave her routine drugs, and she was just coming every now and then. And just within the first 2 months, around the 7th week, before her second visit for antenatal, it ruptured. And that was when she came to a hospital. And that's how she lost her left fallopian tube and had previously lost the right fallopian tube. Now, the only way for her to conceive, if she wants to have babies of her own, is through IVF, right? Fortunately, her eggs are in place. So we need to take the egg and take the sperm from the husband, fertilize in the lab, plant it into her womb, and then hope that it succeeds, because we've not achieved 100% success rate with IVF. And these things are expensive. In some places, it's up to 5 million. That is almost $4,000. All right, 5 million naira. In some places, it's 3.5. And this is the first payment, not the continuous things you have to do all through the process. So it's not good. All right. So we're going to be discussing antenatal care in a way that will open your mind to the key important things you need to take note of, just so you know whether you are getting the right care. It doesn't matter where you go. It can even be a private hospital and they're not doing the right things. You will know because you have been taught. You are the first person responsible for your health, not even your doctor. So having the right knowledge will keep everyone around you in check to make sure they do the right thing. All right. So let's get to the answer to the question. So the woman weighed 82 kg. All right. So 82 kg is the weight in kg. It's already there. Then her height is 165 cm. So we need to convert that to meters. So 165 cm divided by 100 is 1.65. So we're going to now do 82 kg divided by 1.65 times 1.65 in a bracket. You get that because it is weight in kg divided by height in meter squared. If you didn't catch that part of the video, you want to go back a little. We thought about it on a board and explained it properly. All right, so that's how you calculate it. So the answer is 30.1193756. So approximately 30.12. So this lady is very, 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 very much overweight. And there is need for her to see a doctor before she conceives or plan to conceive. Preconception care is important for her. All right, everyone. It's been a very lovely experience. I want to appreciate the Medical Women's Association of Nigeria for making this to happen. Next episode, I'll be having a doctor from the M1 Medical Women's Association of Nigeria to join us. Today, I thought to share this myself because it's a very extensive conversation. And if we go back and forth, it's going to linger for 2 hours or more. And I didn't want that to be the experience. Okay, until we see on Sunday throughout the week, like, subscribe, watch every video we put here, turn on the notifications so that YouTube will let you know Dr. Ovo just made a post. All right, and the lucky person who got the answer correctly, let me just be checking right now to see who they are. We're going to be contacting you and the gift to be delivered. We'll make the announcement first off by next week. We'll announce the 2 persons who are getting the gift, and make sure you are live on the call. If you are the person, we're not making the announcement right now. And we'll have your name, your location, and your information. And that's how we'll spread it. All right. So we'll come your way next Sunday. Keep living and keep having a lovely, fulfilling life. Dr. Ovo here. And peace out.